just to sum up the part of your second question, the highlights of the study.
Yes, please.
The highlights of the study, in residents, we realized that as compared to global standards, even across the globe, there are not many studies in the plastic surgery fraternity. But I would say France has got a very lesser amount of burnout. I would say around 28 to 30% or so. And Saudi Arabia has got a burnout of around 50% in the plastic surgery residents. And in India, we too stand at around 48 to 50%, roughly. I'm not able to recall the exact number as of now. But yes, so that was the resident part of it. And when we came to consultants, we were very happy that we came to a conclusion, or rather our study showed that the burnout in consultants, in plastic surgeons in India is significantly less as compared to the global standards. Again, there are very limited studies, but global standards stand somewhere at around 30 or so. We stand at around 9 to 10. So yes, Indian plastic surgeons are happier.
That's very interesting, Nikhil. I mean, the bit I find fascinating is that you compared it to international studies and then looked at residents. Obviously, when I guess learning to be a surgeon, especially learning to be a plastic surgeon, is a very difficult task, isn't it?
Yeah, it's a long journey. 13 hours, 13 years.
Is it? Okay.
Yeah.
13 years it takes to complete that. So, Nikhil, your own thoughts about why residency might be so stressful.
Yes, actually, I would say it is multifactorial. There are institutional factors involved. There are personal factors involved as well. So when it comes to residency, I would say across India, there would be somewhere around 60 to 70 institutes which give plastic surgery training. So especially when a student from North India goes to South India, there are language barriers. There are food barriers. You're not able to eat what you like. Then there are institutional factors as well. The boss might not be very cooperative. You might not get adequate cutting. You again stay away from family because as plastic surgeons, whoever residents join plastic surgery are commonly above the age of 30. So mostly they are married. Their spouses tend to stay away from them. So I think it would be difficult to compartmentalize burnout into only professional causes or only workplace causes and personal causes. It is, I would say, an amalgamation of all these findings, all these reasons coming together and causing a burnout. And some are able to take stress in a better way. Some are not able to take stress in a better way. But my personal feeling is this: overall, the subsequent generations, not just in medicine, in all branches, overall, the subsequent generations are able to manage stress in a much less effective way than our previous generations.
Okay, that would be very interesting to talk about, and then we'll perhaps do that in the next bit, Nikhil. But what I wanted to ask you was, you very interestingly and I think importantly divided the causes and the management of stress into three bits. So institutional causes are the primary bit, where we can do primary prevention, actually. So factors in the institution like, on-calls and how free the doctor is and the autonomy of the doctor. And then the secondary causes are, again, secondary prevention can be done at an individual level where, like I said, personality factors in the doctor, lifestyles, how they manage time and all that. And then, unfortunately, a lot of stress management is placed on the tertiary bit, which is after the doctor is stressed, after the doctor is depressed and anxious and suicidal, interventions are brought about. So, Nikhil, I'd like to conclude this bit, and then we'll go on to the next bit in a moment. Okay?
Yes, sir.